affected pregnancy outcomes, particularly among people with low incomes and people of minoritized racial and ethnic groups, is unknown, and few empirical studies examine the impact of COVID-19 pandemic on obstetric outcomes at the national level. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman, and today I'll be talking about rise in pregnancy-related complications during COVID-19 pandemic. In a paper published in JAMA Network Open, physicians, scientists assessed how pregnancy-related complications and obstetric outcomes changed during the COVID-19 pandemic compared to pre-pandemic. Looking at the relative changes in mode of delivery, rates of premature births and mortality outcomes before compared to during the pandemic, the team found increased odds of maternal death during delivery, hospitalization, cardiovascular disorders, and obstetric hemorrhage during the pandemic. Molina and colleagues analyzed data from more than 1.6 million pregnant patients who gave birth in 463 US hospitals in the 14 months prior to the advent of COVID-19 and during the first 14 months of the pandemic. There were no statistically significant differences in the two groups' demographic characteristics, including age, race and ethnicity, insurance types, and comorbidities. The team saw a 5.2% reduction in total live births during the pandemic period. Their analysis also revealed maternal death during delivery hospitalization increased from 5.17 deaths per 1 lakh pregnant patients prior to the pandemic to 8.69 deaths per 1 lakh pregnant patients during the pandemic, a small but statistically significant increase. The research team also saw shortened stays in the hospitals. The team also saw a decline in sepsis rates during the pandemic, likely the result of enhanced hand hygiene and masking due to COVID-19. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.